tobacco control? Well, to me, I see it as a very crucial area to talk about in Nigeria. This is what I have been doing for a long time, and I really wish that a lot of people are aware about what tobacco does to the body or to our nation, to our continent, and to the world at large. Tobacco kills over 7 million people every year, which means that every day, more than 19,000 people die from tobacco use or second-hand smoke exposure. Most tobacco-related deaths occur in low and middle income countries, of course, which Nigeria is also a part of that. It is shocking to also know that tobacco kills up to half of its users. Just to run through this slide, around about 80% of the world's 1.1 billion smokers live in low and middle income countries. Those are statistics that should give us reasons why we should involve in tobacco control. Now, another shocking thing is that tobacco contains over 7,000 chemicals. About 50 of these chemicals are known to cause cancer, different type of cancers. All right, with just a puff of that cigarette, those are the reason why I got involved in tobacco control and why I feel anybody that wants to go into tobacco control should go into tobacco control. You need to know what is in that stick of cigarette or what is in any other product that the tobacco industry are producing for you to effectively advocate against tobacco. Now we have arsenic. Some of us here, I'm sure the doctor in the house and one or two people would know what arsenic is. Arsenic is used in a rat poison. Now, obviously, we all know that when you see rats around your place, you buy some kind of thing along the road. Those are the type of thing we're talking about here. It is included in just a puff of cigarette that people take. Another one is formaldehyde. Formaldehyde for people who also work in the hospital is used to embalm dead bodies, or also can be used to preserve things. All right, let me just jump. We have ammonia. Ammonia is used to clean toilet, just like we have Apic and the rest. Now, these things are true. They are not things that we are making up. These are what the tobacco industry are putting in just a stick of cigarette. Talking about cigarettes now specifically. Now, we also have polonium-210. Polonium-210 is a highly radioactive element. So sometimes when you see smokers, some of the evident ones that we see, when you look at their tooth, you see that they have decayed tooth. Yeah, and you can see a lot of people also who have problem breathing. There are so many things associated to tobacco smoking. Yeah, it leads to most common disease affecting the heart, liver, and lungs. It is a major risk factor for heart attacks, strokes, chronic obstructive pulmonary diseases, which is COPD, particularly lung cancers of the mouth, bladder, and it also causes high blood pressure. Now, this gives me enough reason to want to say, okay, I need to get myself involved in tobacco control. Now, for a lot of pregnant women also, you discover that any pregnant women that smokes, they will have miscarriages. Most of them will have miscarriages, and of course, we have premature birth, we have low birth weight, and the list goes on. Now, let me quickly move on to tobacco control measures. tobacco control measure. These measures have been put in place by the WHO, the World Health Organization, to help us control tobacco and to reduce tobacco use. Now, the measures are just there for us to see. The first one is price and tax measure to reduce the demand for tobacco. In Nigeria recently, you will discover that the federal government just raised the excise tax on tobacco by 2%. Now, that is quite low compared to the World Health Organization's recommendation. World Health Organization's recommendation is 75%. So Nigeria, we are still we are still operating below the recommendation of the WHO. So those are that's one of the measures put in place by the WHO to reduce demand for tobacco. Now, of course, we also have protection from exposure to tobacco smoke. Now, these are articles that was taken out from the WHO Framework Convention on Tobacco Control. These articles are put in place for tobacco control advocates and governments to to establish a law, a tobacco control law in the country, and to follow it up so that it is implemented. In Nigeria, we have a Tobacco Control Act now, which was passed into law in 2015. Yeah, the Tobacco Control Act, I am aware presently that there are regulations currently going on to expedite the implementation of the Tobacco Control Act in Nigeria. However, we all know that implementation in Nigeria is also very slow. And that is a major problem that we have when we have a law in place in Nigeria. Implementation is always very slow. All right, I will just jump to packaging and labeling of tobacco product, which is the Article 11 of the WHO FCTC. Yeah, here presently, we don't have much about the packaging and labeling, just little information on the pack of cigarettes, which we all see. Tobacco smokers are liable to die young. That's what we see there. Yeah, but in a lot of in some countries, let me use Senegal as an example. In Senegal, they have a pictorial warning covering about 75% of the cigarette pack right now. And I asked some of my friends there, I asked them, what is now the result of the pictorial warning that you have on the cigarette pack? They said, well, cigarette has drastically reduced. Cigarette smoking has drastically reduced as a result of that. I said, why? They said they went to the same smokers who were smoking without, when there was no pictorial warning. And they asked them again, are you still smoking cigarettes? Some of them said no, that the cigarette now tastes bitter. Well, I am aware that the tobacco industry did not change any ingredients in the tobacco or cigarette. I believe that what the people saw was probably the pictures showing someone who is down with tobacco-related diseases. And that alone discourages them from smoking cigarettes. As we say, a picture is more than 1,000 words. So what people see goes a long way to help them in changing or forming new habits. Yeah, so that is one thing that in Nigeria that we also need to work on. We also need to work on that. Pictorial warning is part of the National Tobacco Control Act, but of course we need to take it one step at a time. Oh, another thing there is education communication, training, and public awareness. Now, part of the thing that we are doing today is to also educate us more about tobacco. What is in tobacco? What harm can tobacco do to the body? And communication training and public awareness. I talk to a lot of people, just walk around Ibadan and ask, does anybody know whether there is a tobacco control law in Nigeria? I took the sample and I asked about 10 people. Not one among them is aware about the tobacco control law in Nigeria. I don't know how many of us are also aware that we have a law. We don't have, it's not a law yet in Ibadan, in your state, but there is a bill to domesticate the National Tobacco Control Law, the National Tobacco Control Act. It started, I think, 3 years ago, and it was signed by the State House of Assembly, but it was not signed by the governor. So it's part of why we are doing this also, so that tomorrow when we go on the street and walk, we are also going to remind the Oyo State government to sign that bill into law, so that Oyo State government can also be part of the 5 states that have domesticated the National Tobacco Control Act. All right, then tobacco advertising, promotion, and sponsorship, TAPS. Yeah, right now in Nigeria, that has been reduced drastically. We don't see much of that anymore. However, what they do now is to diversify, go through the farmers, go through means of agriculture. Yes, when they buy tractors for farmers, they fund them to farm a lot of other things. And of course, what are they saying? It's a means, of course, when they farm, when the farmers are producing whatever crops they want to produce, they will be advertising British America tobacco, and they will be putting on their uniform, they will be putting on their t-shirt, and that is also a form of advertisement. And this Tobacco Control Act in Nigeria is also against that, of course, but we cannot stop that because it is part of their own corporate social responsibility as it is, because they now have a tobacco foundation. In fact, they have tobacco control sector in that foundation, and a lot of us have been approached to come and help them facilitate that. That is so funny. The tobacco control advocate will help the tobacco industry to facilitate the tobacco control unit in their BAT foundation. It is not funny, and it is also funny, but that is where we are going. So we've seen in the past some of our colleagues who have actually joined the tobacco industry because of money. But as I'm speaking to you, I would not join them because I know why I am in this fight in the first place. I show you why tobacco control, and that is why I will never go and join them. Now, Article 5.3, which is what we make noise about every now and then, is to counter tobacco industry's interference. I remember vividly in 2008, we went to a school just to sensitize the students on the harmful effect of tobacco smoking. And we saw agents of British American Tobacco trying to advertise Philip Morris brand of their cigarettes to students. Now, what they did was they gave each student, specifically male and female student, an invitation card. The invitation card was to invite them to a party. At first, it was not written on the invitation card that it was BAT, but when we took one of the card also because they didn't know us at first. So we disguised and went for the party too. The shocking thing is that a lot of young people were at the party. But before you gain entrance to the party, you have to puff a stick of cigarette. That is your pass. They will give you a cigarette and you puff a stick of cigarette. Then they will ask you to go inside. They will not take it back from you. You're going to finish that stick and then you go in. That is your pass into the party. Now, that is totally shocking, but these are facts that has happened in Nigeria. Yeah, of course, a lot of fight went on as tobacco control advocates. We threw a lot of things out there and it led to a lot of things and they stopped all that. I am sure that they are still doing a lot of secret events that is even unknown to us right now. Some of them we know, some of them we don't know. But we know that tobacco industry are always trying to interfere. Even the tax increment that the federal government just approved right now, the effort of tobacco industry is what is delaying the federal government presently to put necessary regulations in place. Because I have some privileged information that the tobacco industry are disturbing them seriously, writing letters to the Ministry of Finance, to the Ministry of Health, and necessary ministries just to make sure that they put away this tax. They don't want that. Meanwhile, we are still operating below the WHO's recommendation. All right, let me just continue. Now, another measure to reduce the supply of tobacco is the illicit trade in tobacco products. About 4 days ago, the federal government of Nigeria also ratified the illicit trade protocol, making the 35th country in the world to ratify the illicit trade protocol in the world. Now, the illicit trade protocol is a protocol to reduce illegal and illegal supply of tobacco products in Nigeria. We know that a lot of those cigarettes come in through our borders and a lot of that. So we've written a lot of things out there to ask our government to implement, since they are presently, they have ratified the illicit trade protocol. So we have written a lot of things out there to make sure that our government puts necessary measures in place, to put track and trace method in place to track, okay, which cigarettes are coming from Nigeria, which one was produced in Nigeria, and also to tighten our border system. Yeah, we were in Abuja 3 weeks ago, and these are the things that we discussed with the officials from the Ministry of Health. Now, another thing there is says to and by minors. Now, shockingly, I made a presentation in South Africa 2 months ago, and the presentation showed a picture of a child selling cigarettes to another child. Now, this is against the law, the tobacco control law in Nigeria, and nobody is seeing that. I saw a federal ministry of health official there that if we don't put necessary measures in place, if we don't start implementation, this thing is going to get worse, because we're not even having presently cigarettes being sold to the minor. It is now a minor selling cigarettes to another minor, which is totally against the law, the tobacco control law in Nigeria. So these and other measures, I'm sure, will be put in place so that implementation can be fast in Nigeria. Now, the last one here is the provision of support for economically viable alternative activities. We all know that for this, it may be a little bit difficult to achieve, and it's going to take a long time to achieve this. but we know we'll get there in Nigeria. All right, just so that I will allow questions. I have a lot of things on my mind is coming through, is rushing through, but I will allow questions to prompt them so that I can answer them. Now, in conclusion, I say tobacco control can be used as a tool to rescue millions of people from the great and alarming tobacco death train. Let us together make Nigeria a smoke-free nation. I thank you all for listening, and I'll stand by for your questions. Thank you very much.
Thank you, Mr. Omiyefa. Very good presentation. Very, very lovely. So, for everyone that has joined the conversation, I'm very sure we had a lot of insights to what Big Tobacco is doing as regards ensuring that they continue to have sales and ensuring that people continue to consume their products. So now we'll take comments and questions. So please, if you want to say something, kindly unmute your mic or raise your hand. There's the option to raise your hand at your left, your bottom left, or you could unmute your mic at your bottom right. So you can do either of those two, and you can have your question. You could as well also send them through chat if you are not able to do either of that, either of those. So while we wait for them, I have a question for you, Mr. Seye. Sir, you talked about how Big Tobacco continue to influence our communities, continue to ensure that sales continue influencing little children in secondary schools, our communities, our farmers, and all of those things. Now let's come to individual, to the making decisions by individual. Let's come to the reality from different socioeconomic situations that will make them go into all of this. So for the farmer, for example, he has land. He's not able to farm because he does not have resources. Big Tobacco, which American tobacco is coming out. They are saying that they're going to give them that resources, and they should start farming tobacco. And that would provide them some source of financing, source of resources for their family. Then there's peace. What do you think can be done in this regard? How do we cope with this kind of thing? If we want to go into communities, what do we tell them? Do we tell them to stop their source of life? Do what? So kindly help us for others, if you have any question, you can unmute the mic or you type a message on the chat. Olayinka, do you have a question?
Okay. Let me quickly answer that right now.
Okay.
To start with, well, we need to arm ourselves with information. Information. If we don't know how to talk to these farmers, how are we going to convince them? Now, let me shock you with this fact that tobacco workers and farmers also have diseases that they battle with. Tobacco workers also suffer from what we call green tobacco sickness, GTS. And GTS is caused by the absorption through the skin of nicotine from contact with wet tobacco leaves. Now, if we don't know all these things, and some of them are actually suffering from those sickness right now. Those sickness, they are suffering from it. So if you go there, we also need to arm ourselves to be able to identify some of the symptoms. Some of the earlier symptoms of that is nausea, vomiting, weakness, headache, dizziness, abnormal cramps, difficulties with breathing, and high blood pressure, and the list goes on. You see, by the time we know this information and you want to talk to a farmer, for instance, you need to let them know why they shouldn't do it. Now, that is another thing we also need to do, is also involve ourselves with other organizations that can provide alternate livelihood for these farmers. Because to be candid with you, if it was my great-great-great-grandfather too who had a land somewhere, and the British American Tobacco was saying, let me help you, I'm going to pay for your charge. Meanwhile, let me shock you. In 2006, we went to Seye there, where we have the tobacco control farmers. And funny enough, tobacco industries do not pay them cash, just for you to know. They are the poorest of the poorest of the poorest of the people, and among farmers, they are the poorest. What tobacco industry does is just to give them what they need to work, sponsor their children to school, and give them little incentives, but they do not pay them, just for you to have that information. So when they tell you, or when they tell those farmers that we are here, we want to pay for, I mean, we're going to pay for this, we're going to pay for that, it's just propaganda. They don't actually do that. They don't pay. I'm not sure if they are paying now, but when we went there, they were not paying those farmers. In fact, those farmers were lamenting. And of course, then there was a grant on grant. So we had to support those farmers with something to do, to make them go into alternative livelihood and not farm tobacco again. But of course, we know that we can't do that for all the tobacco farmers that we have. But what we can do is to make sure also that we disseminate this information about what is in tobacco. Let us put out those information to those farmers. Let them know that whatever sickness they've been suffering from is as a result of tobacco that they are farming. I'm sure nobody will want to die farming tobacco when they can farm any other thing and still make money from it, regardless of the lies of the tobacco industries. So these are things that we need to arm ourselves. We need to arm ourselves with those information and engage ourselves with organizations that can produce alternate livelihood for those farmers who are currently farming tobacco. So this is not just something that we can do alone as a tobacco control advocate. It is something that we need to partner with other organizations who are also against the tobacco industry and what they stand for, so that we can all achieve that goal together.
Thank you, Mr. Seye, for the answer. Do we have any other question for Mr. Seye before we go into the next session? Mr. Yinka, you seem to have something to say the other time. Are you ready now? Mr. Yinka? I guess it's not there. Do we have any other person that has anything to say? Any comment, any question? All right. I guess we're all good. So we are supposed to have Yinka, are you there now? The mic is on. Okay.
I can only listen for now.
Continue. The network is not so great.
The network is really very bad here, and I've been trying to switch between networks, but it's just the same thing. so I can only listen. I can't ask questions. I would prefer to just probably type my questions under the chat session.
Okay, that's fine. You can just type your question, and then if I'll read it out to everybody, and then we can take it. So if you are ready, you can
Oh,
just type
okay.
it. Thank you very much.
Okay, I'll do that.
All right. Do we have any other person with question? So we are supposed to have Oluwatomi Iken later on. So I guess what we'll do is to take a break so that we can all try to get ourselves fine for the next session, and we don't just have so much of information at the same time. So can we meet back in 5 minutes? Or let's just say, let's start at 4. Is that fine with everybody? Hello, is that fine with everybody? All right, then I guess we are good with it. Let me just type it just in case. Uh, yeah. The question for now. Okay, it's not.
Um, hello, hello, Toyi, are you there?
Oh, hello, Yinka. So yes, I got
Okay,
your
yes, I think I can actually. Okay, you got my question
I got your
already.
question.
Okay.
So we'll take that before we start the next session. So let's meet back in like 2 minutes so that
Okay. So that question would actually lead to another one. So I think I would prefer to ask the other one with my own particular voice with the.
all right, that's fine. That's fine. So when we start, Mr. Seye will start by answering that question and then we'll take it up from there. Is that fine? All right. I guess network is a bit of an issue. All right, thank you everyone. See you in 2 minutes. Bye.